So just to give you a very brief overview, I'm not going to read all of this, and I'm going to move through these slides somewhat quickly because really we want to get to the core demonstration of the actual platform so that you can see it in action. So DVBeds was created by advocates for advocates. It was started in Dallas, Texas at the Family Place and came out of an opportunity where the Family Place was hearing more and more from the Dallas Police Department after they adopted a lethality assessment protocol. So they and other shelter programs around them were being inundated with calls and just were scrambling to find placement for the survivors that were being referred to them. So they organized themselves, they created the platform and launched the tool in 2019. The National Domestic Violence Hotline actually piloted the tool on our advocate dashboard and determined that it was quite effective in seeing real-time shelter bed availability in those locations. So in 2025, we launched it nationally as a program of the National Domestic Violence Hotline. This slide, unfortunately, is a little bit old. We are now in 26 states and DC, and we are close to 150 programs across those 26 states and DC. Next slide, please. So there are a multitude of benefits to being a participating provider within DVBeds. DVBeds not only facilitates faster placement for the survivor, but it's trauma informed. It's known to reduce stress, both with the advocate who's trying to find placement for that survivor and the survivor themselves. So it's designed that advocates can log into the system and within a few clicks of a few buttons, they can see which shelter programs have bed availability live. They can review acceptance criteria and then make a warm transfer for that survivor to that program to see if they would meet the criteria and that program could accept them. So our current users have shown or demonstrated that it's reduced advocate stress. It supports travel planning. So if you're looking to place a survivor in a location that is further away from where they are at that point, this tool can easily facilitate that. It also provides informed access. So we do our new updated website lists a number of new additional tools that can show someone who's looking for placement for that survivor, the criteria that they accept, what they provide, and the additional services and programs that may provide additional support to that survivor. Next slide, please. Here again, it just illustrates the effectiveness of using DVBeds. So current users have said that it boosts staff morale. It certainly optimizes shelter utilization. The real-time updates and metrics not only maximize the shelter space, but it provides an ease of access and eliminates the need of programs to call other programs or email or work with shared lists or network to find placement for those that they're working with on a day-to-day basis. We also have a tool built in that helps users easily collaborate with other community members. Additionally, we collect no identifying information about the survivors. We do, and Kimberly will go on to show you how it works, but we collect some basic information to ensure that the program that the survivor is looking to find placement in is a match for that survivor and the program that would be accepting them. It also helps in times of disaster readiness, so hurricanes, fires, when emergencies happen and shelters have to evacuate, this tool would help very easily place survivors in different locations. Next slide, please. And as you can see here, this is just some feedback from current programs using DVBeds. Really, the tool is very easy to join. We have tried to make the onboarding process as simple quick and easy as we can. And then once you're set up and using the system, it takes literally less than 5 minutes a day to update your bed availability. So really the users are saying that it really is very easy to use and helps facilitate live placement much more quickly than more traditional uh, forms of outreach. Next slide, please. So our onboarding process is very, very simple. Uh, if you're interested in joining and registering, we ask that you complete an intake form, which is easy to complete. I think it consists of 50 questions. We do ask programs to sign an MOU, and those agreements include updating your bed availability every 24 hours. You collaborate in good faith with other programs who are looking to place survivors and do the same in return. And then you provide warm transfers for that survivor. So rather than sending them away with a list of organizations they can call on their own, that you keep that survivor on the line and make that warm transfer to a shelter program that may have the ability to accept and help them further. Next slide, please. All right, so now I will turn it over to Kimberly Davis, and she will be able to walk you through the live platform and actually show you how DVBeds works.
Great. Thank you so much, Gretchen. So I'm going to share my screen. Again, my name is Kimberly Davis. I'm the regional coordinator with DVBeds and the National Domestic Violence Hotline. So I think it's so important to see how this system works from beginning to end. So if you can see my screen there, Gretchen, can you give me a thumbs up?
Yes.
Perfect. Okay. So as Gretchen said, DVBeds is a web-based platform, which means you can access this from your cell phone, tablet, or computer. There is no need for you to download or upload any apps, and we believe that's very important. Once an advocate has access to the site, they sign in simply like they would with any other site. So the page we're seeing now is the very first page an advocate always sees. This is the shelter availability page. What I want to show you first is the only thing that we have advocates do in DVBeds daily, and that is to update their bed status. It literally takes under 3 minutes. So this is how it would work. An advocate would log in, and their very first step would be to find their name in this list. They simply click the name of their shelter or facility, and then they will have their bed availability pop up. And there we go. Bear with me, it's a little slow today. So what you see here is the inventory of this shelter's bed availability. This is every bed they've told us they have, and they are named the same way they are in their facility. So an advocate would essentially look at their bed inventory and say, yes, this is exactly what we have available right now. And they simply go to the right-hand corner at the very top, big purple button, click Confirm Current Status. That is the only ask that we have of the team in a 12-hour period for DVBeds. If there is a change that they need to make, that is simple as well. They will click the pencil. Anywhere an advocate sees a pencil is something that they have the ability to change. So if they're exiting a client from this particular room, they would click that pencil. Here, there's a drop down to change the status if need be. And here they would change the number of rooms available if that need be as well, simply with the arrows. So essentially they've exited the client, they've updated this profile. For that particular room, they click Save. And once they click Save, they confirm their current status. Again, they are up to date for the next 12 hours, and there is nothing else we ask them to do unless they're using the tool for themselves. Okay, so back to the availability page. What an advocate sees here from the far left going to the right, the colorful tabs, these tabs indicate how recently this room was updated. And that also coincides with this very last column. So technically you can see at the exact moment that an advocate updated their rooms. And that is extremely helpful when trying to place a survivor. So I'll go really quick through the other things you see here. From the left to the right, you see the name of the facility, their contact info, which is only hotline. We contact each other hotline to hotline. You've got their city and state, their primary point of contact, and then here the most important thing on this page, I think, is how many rooms are available. And this, if you hover over family rooms, you'll see family beds. It's important to note these are not rooms that are available. These are beds that are available in this particular type of room. So I'll run through a scenario. I like to call my survivor Sally. So I have Sally on the phone. She has called my facility, and our facility is full. We don't have any beds available for her. My conversation with Sally is, although we don't have a bed in this facility, I partner with other locations. Let me check. So I'm going to place Sally on hold and access dvbeds.org. Okay? And now I'm going to say, well, Sally has told me she's here in Dallas with me. So let me find a bed for her. Far right corner, search button. Again, we love the large purple buttons. I'm going to search for a room specifically for my Sally, and I have to tell this platform what my criteria for her is. First and foremost, where is she closely located to? We do not accept any identifying information. So we don't need her address or phone number. We simply need her city. So I'll say she's here in Dallas with me. And through my conversation with Sally, I've learned that she has a job and daycare. So she doesn't want to be too far away from those things. I'll choose a 50-mile radius for her. Now, search beds. We need to tell the system exactly who's coming. So I'm going to tell it we need 2 beds. One is going to be for Sally and one will be for her toddler. And of course, we'll need a family room for that. Here, I'm going to tell the system who's coming. Mother. And again, the only information we're putting in is mom and age. This add button will allow you to illuminate it as many times as you need, no matter how many children are traveling with her. We can add. So I'll add the next family member as a child. We'll say 2 years old. That's the perfect age. We'll also say female. And now you don't need to hit add again unless you're adding another child. But what if they have pets? Scroll down and we have the availability to add a pet. We have cat, dog, and other as our options, and whether they are or are not a service animal, which is super important when you're placing a client. Now that we have that information, I could hit search. But what I want to do is make sure I've told the system exactly what I need. So you have other options in the search services. What if you need services for your client that are specific to that particular survivor? Well, these are a list of services that you might be able to get for that client. Also, if you have gender or youth services needs, we have a list full of other services. And the reason we would use these drop downs is, what if we have a survivor who is deaf? We need to find a location that's going to specifically fit that need. We do have Native American. We have shelters that are on reservation. And so you need to know that if that's what your survivor needs. Now we've put in all the information. We're going to ask the system to search specifically. So rather than the 86 that was currently listed before, we have a manageable number of 7 facilities that will work for my particular survivor. What you'll notice from the far left is the distance. They are all less than 50 miles away, which is what we asked the system. And if you scroll all the way over, we can see the bed numbers. So they all have at least 2 beds, which is also what we asked. Now, at this point, I train advocates to do a couple things. We don't need to go back to Sally and say, okay, I found 7 facilities. Which one would you like? I would choose the one that's either closer or the one with most beds. Because if I choose this facility and it has only 2 beds and I need 2 beds, what if someone has beat me to that phone call? And now Sally doesn't have room in this facility. So I'm going to go with the one with the most beds, and it's still less than 4 miles away from her city center. This amazing button allows us to request that that facility hold the 2 beds that I need. I simply identify the facility I'm requesting from and confirm that that's what I need. Now this green box has indicated that facility has received an email. That email, Kimberly requested 2 beds in your facility. Now, for all the advocates you all know, no one is sitting on the other side of that computer waiting for an email to request a bed. So we have, at this moment, I have advocates call immediately, hotline to hotline. And the conversation is this. This is Kimberly. I found you on DVBeds. I see that you all have beds available. I need 2. Can you confirm those beds are available? Hopefully, the answer is going to say, yes, absolutely, those beds are available. You can transfer the caller to me for intake. This is the point where we do the warm transfer. The warm transfer simply means you've called ahead as the advocate. You've gotten a confirmation that these beds are a potential available for your survivor. And then you hand the call off. I'm going to either transfer my Sally to the other operator, and if my phone does not transfer, this will be the only time that I give this number to my survivor. Sally, go ahead and call. Tiffany is waiting for you to do your intake. That is the end of the process for our advocates. That is how easy this site works. There are a few other features and functions that we don't need to go into now, but that is what the basis of this service is. I'll show you one additional feature that we just recently added. We're very excited about it. At the very first page, you don't see much information, right? But what if you need to see a little bit more to make a conscious decision about if this is the location you need? This little arrow is a drop-down arrow. Once you click that arrow, you're going to see every bit of information, a description about that facility. You'll see their rooms availability, the services that they offer, whether it be gender or youth services, and any special population served. So at first glance, an advocate will know if this is a spot they even need to spend the time calling. When they no longer want to see that, they simply click the arrow. That is DVBeds. If you have any questions at this point, feel free to post them in chat. I think they're going to help us with that. And thank you guys so much for your time. We certainly appreciate being able to show you our amazing tool.
Great. Yeah, so I wanted to add just a couple of additional points. So not only is the shelter bed availability visible to users of DV beds, but it ties into our advocate dashboard. So then our national domestic violence hotline advocates can see that live bed availability as well. Just to give you any context, we interact with over 1,100 individuals every single day and direct them to local resources for them to find further uh, help. So not only would participating in DV beds be beneficial just for you to look, but it also reduces the number of calls that you receive, not only from the hotline, but other agencies in your area that may be looking for placement. So it reduces the time you have to call to find that additional placement and reduces the number of calls that you receive coming into your program. We also are working to build out data points where within a few clicks, you'll be able to see live how many people you were able to serve, how many you had to turn away due to capacity, and a number of other different points. So those are additional incentives and pieces of DV beds that are just more beneficial to your program. So it looks like we have a question here. It says, does our shelter have to be active on DVBeds in order to use the DVBed site? Yes. You have to be an active participant to use DVBeds. All right. Other questions? I'll give
Tons.
it a,
We've got tons of questions in the Q&A.
oh, fabulous.
So I guess we can kind of go down the list, although there are some similarities, so we'll try to condense things where we can. The first question is, this is different. Do you have to be a DV-based organization to access DV beds? If you support finding housing generally, can you access?
You can. So if you are working with survivors to find housing, um, and you meet our acceptance criteria, which is most everyone, then yes, you can become a participant of DVBeds. So you don't have to offer shelter in order to participate in the program.
Awesome, thank you. This next question, if you are in a state that does not have DV beds but live close to a state that does, can you utilize the site to place survivors in a different state?
Yes, absolutely. DVBeds is available for everyone in every state that wants to sign in. So it just is a matter of if a facility in your state has already signed on to DVBeds, and you can see any other availability in any other state, in any other facility that has signed in with DVBeds or registered with DVBeds.
Awesome. Um, I think you shared the form earlier, but someone asked, we're an advocacy program in Michigan. How do we get connected with this resource?
Yeah.
I'll drop the registration form into the chat. And we have actually had a few conversations with the Michigan State Coalition, and we'll be following back up with them to talk about encouraging their member programs to sign on. But you don't have you don't have to be affiliated with your state coalition per se. You can certainly, if you're an independent program and you offer housing, go ahead and join, or we'll also drop our contact information in here if you'd like a private discussion or a deeper demonstration of the platform. We're more than happy to set those up with you and speak to your individual needs.
Awesome. I think you've answered a version of this already, but just to cover all bases, can you join if your organization does not have a shelter?
Yes, the organization does not have to provide shelter. They do have to be an organization with advocates that deal specifically with DV survivors. So they can be listed as a resource, which is also another new feature that we have.
So we do prioritize shelter providers and organizations that work to place survivors in safe housing. So, if you fall out, if your organization falls outside of those descriptions, we can certainly have a discussion. It doesn't mean that it's a blanket no, you can't participate, but really it's meant to facilitate those direct connections for survivors.
Thank you so much. I think that answered another question someone had in the chat as well.
Great.
I'm gonna kind of try to skip through. I think some folks are wondering how to sign up, and I know that you dropped the link to the form in the chat and that you've shared the email address where folks can get in touch with you folks. Someone asked this question, and it was related to whether there is a fee to utilize DV beds, which I shared. This is a free service. Someone had a clarifying question: free to the survivor, question mark, and the agency referring, question mark. Is this open to survivors?
This is not open to survivors. This is only advocate facing. So survivors should not see or have logins to this information. And it is free to participating facilities, whether they are sheltering or non-sheltering. If they fit our criteria, they can definitely participate if they're non-sheltering. And there is no fee. There is no minimum or maximum number of sign-ins that they can have. Their entire team can have access, and it is still going to be free.
Awesome. Thank you for being so clear about the accessibility of this tool. Um, I again, I think you've answered a version of this question, but I don't want there to be any confusion. So if an organization is a women's shelter, but doesn't work specifically with DV survivors, but does house them in the shelter with others, are they eligible to join? Or do you
I
recommend people
think
reach out to talk more?
we would recommend, in that case, we would recommend they reach out to us to talk more. If they have uh, domestic violence, sexual assault advocates on staff, we would be more inclined for inclusion. But um, we do prioritize those programs that have that experience on staff or have an arm of their organization that provides that specific type of supports to survivors of domestic and sexual violence.
Thanks, Gretchen. I think another person is wondering, I assume they're referring to the listings within your tool. I think they're asking, does this include hotel and motels, or is this just entirely domestic violence shelters?
Right.
It's just shelters. So we don't have a hoteling tool, although there are programs that house survivors through their own hoteling network, and those are eligible for inclusion. We do have partnerships with other organizations that provide that hoteling feature that we would be happy to connect agencies with, but this is strictly a shelter.
And different question, is there a listing of which states are participating and which shelters that can be shared?
I can probably pull that up in just a few minutes, and let me see if I can access that. It may take me a minute.
Are you wanting to put it in the chat, Gretchen, or how are you wanting to?
I was gonna just maybe share the map that
Okay.
we recently created. Bear with me. Feel free to move on to another question while I'm looking for that. I'm happy to share when I'm ready.
I'm gonna pick what I think is maybe like an easy question because I know you referred to this a little bit. Are there any requirements for programs to participate other than agreeing to rules that were described? Is there a vetting process?
There is a vetting process. It's a light vetting process. We do in the registration form, we ask agencies to list the services that they provide. We don't accept agencies that charge for services. So that is one of our primary disclusions. Also, as we spoke earlier, we do we're careful about we have deeper conversations with agencies that may want to participate but don't necessarily have that advocacy arm incorporated into their program. So we do prioritize um, agencies that have specific programming related to domestic and sexual violence. Thank you,
Gretchen, I
Kimberly.
have,
Yes,
yeah.
perfect. Thank you. So these are where we have current organizations participating. Some states we're trying to build out uh, more than others, and we have greater participation in some compared to others. But as we mentioned earlier, we are engaging quickly and prolifically with a number of state coalitions, government agencies, and other organizations to share the information about DVBeds with their local providers. Yep, we don't have any in Florida yet, unfortunately. Yet is the operative word, but we're making our way. But if you're connected there and you know organizations or you have connections to your state coalition or other agencies that can bring shelter providers and other organizations together to learn more about DVBeds, please reach out. We're more than happy to schedule presentations and hold one-offs to just show them the tool and how beneficial it really is to the programs. So I'll share my personal email address in this chat. You can reach us in many ways, but I'm most reachable via email.
Thank you so much. I think you answered several folks' questions by sharing that map, so really appreciate that. We still have a pretty great list of questions, and I think we have a decent amount of time if you folks feel good to keep going. Anything that we don't get to, we can potentially put together a frequently asked question document, perhaps. Maybe there's some way, that we can make sure that any open questions get answered. I think there's a couple of really great questions here that I want to move along with. Does DVBeds provide, I might not be as clear on this first part. Does DVBeds provide one, transportation, two, interpretation support, and three, do you ask for immigration status?
Those are great questions. On the transportation piece, no, we do not. DVBeds is specifically a tool used by advocates and programs. So any transportation would be established within those two organizations, the one requesting the visit or stay and the one receiving the survivor. And then the second part, what was the second one?
Interpretation support. So
yeah, it would be the same with that, because once a facility is signed up with DVBeds, that is really the extent of DVBeds outreach in between the systems. Those two facilities would work together. We don't provide any transportation or any interpretation from DVBeds.
However, the hotline the hotline provides interpretation. They can always, they or the agency can reach out to the hotline and be connected to an advocate who can either provide that interpretation themselves or be connected to another service. We provide interpretation in over 200 different languages. So that hasn't yet been incorporated into DVBeds, but it's certainly on our horizon. We understand that that will be a need. And I'm sorry, what was the last? There were three. It was a three-part question.
do you ask about immigration status?
No, never. It's all anonymous. We store no information. So we only ask the details needed in order to find appropriate placement for that survivor. So we don't do that through DVBeds or any of the services offered through the National Domestic Violence Hotline.
Thank you. This is kind of related. Is ADA accessibility searchable?
Yes, there is a place where you can, I actually can show you with the screen. There is a place where you can say what you need under the services.
Awesome.
Let's see here. See if I can share my screen again and show you where that is. Okay, let me share my screen. All right, let's see if I can try this. There we are. So as far as the ADA accessibility and even language accessibility here, when you see special population served, you can.
We
Would we be
can't
able
see your
to?
screen.
Oh, no, not. Let's try it again. There we go.
There we go.
Are we there?
It's
Okay,
loading. Yep, there we
there
go.
we go. So under special population served, you can choose whether or not you do have a deaf person who needs room, and it'll search for rooms based on that criteria. And then here on the front page, if you look at the settings wheel here, advocates are able to enable the ADA accessibility. So they can see, once they enable that, they can see here any facilities that are with the check marks. So you can see that immediately when you log in.
Awesome. And thank you for demoing that. There's a couple questions about human trafficking and sexual assault. Um, Someone was asking if, I guess maybe if it's a feature, perhaps a way to search. Other person was asking, is this available to human trafficking? I guess survivors who need housing, um, who are human trafficking.
So we are prioritizing domestic violence providers for building out that resource first. Agencies that offer support to survivors of human trafficking can certainly participate, although we can't guarantee that there is shelter availability for them. As I am sure that this audience knows, domestic violence programs are sometimes limited by different funding options and policies that only allow them to accept survivors of domestic violence. However, down the line, we may be considering expanding those offerings to accommodate trafficking survivors. We understand there's a lot of overlap. We certainly don't want to exclude any survivor of any kind of violence, but I can say we're growing to accommodate that. We're not quite there yet. Mhm. Thank you, Deborah. It's good to see you on here.
There are so many great questions here.
Good. Keep them
Gonna
coming.
Yeah, take us probably another 7 or 8 minutes with these questions. Um, Someone asked, our shelter does not classify our rooms as single or family. They all have one full-size bed and one bunk bed. How would a shelter label that in the system for beds available?
So you would be able to label them at their current use. Let's say you have 5 beds that are currently full and they're full with singles. You have the ability to list the other 2 as family beds, and you get access. Once you have access to the site, facilities can maneuver through that however they like. So if you get a family that comes in, you can change a room that says single to family so that it shows actively and effectively what they're currently doing.
Thank you so much for answering that question, Kimberly. I think this is a good question that someone is asking. Is there an assumption that all sites listed are confidential?
They are.
There,
I'll let you speak to that, Kimberly.
I was going to say there is that assumption, but that's also part of the vetting. That is another reason why we don't partner with companies that are not that are individual, because we need them to have the trauma-informed care and we need them to be confidential. And the information that's put online on DVBeds is specifically given to us by those individual shelters. So any phone number or address that you see is safe because they've given it to us to list.
Right. So it's usually their public listing. We don't ever publish confidential private location information.
Thank you for clarifying that. Um, I I think this is an important question, so I don't want to skip it. We serve both men and women of domestic violence and sexual assault. Is there a way to distinguish which shelters serve both genders? I'm assuming you have a checkbox for that.
Yes, there absolutely is a checkbox for that. And I will show you. Let's see if I share the right screen first this time.
Not yet.
No,
Right now, we're seeing your background. And while you
give it.
pull that screen up, I'm going to answer someone else's question. Someone asked if you have a list of whether shelter takes pets, and can tell this person that you folks have a checkbox for that. Um,
We do.
they
We
they
do.
said they may
So
have missed this earlier, so just letting them know.
that's all right. In the search feature, when you go to search for beds, here is where you can put in how many people are needing a bed and what type of room they need, and also whether they do or do not have pets. And when you're searching for services, general services, gender is going to be under gender. So we have shelters for men, or only serves men, or only serves women.
Thank you so much. I'm going to try to bundle. I think these are three really good questions, so I'm going to try to put them together and close us out on this note. Um, so bear with me. One person asked, what seems to be the barriers to states or programs within certain states agreeing to participate? This is a similar question. What is the biggest pushback you get from shelters about joining the service? Um, and I think this is kind of similar, I mean, but maybe not similar, but related. Have participating programs seen a significant influx of client referrals upon signing up?
Yeah.
So I can answer the first part. I think, Kimberly, you may have more information about the last, but so what we're finding is that there is a lot of excitement when folks see the platform. Where we find the lag in participation is just capacity. So I think a lot of I know I'm like this when I see a new piece of technology or I get a sales pitch from someone, I shut down because I'm like, I'm already juggling 1,020 plates. I don't have the capacity to process one more thing. So we understand that shelters are at capacity and beyond capacity. So having them make time to hear about the program and then think about the onboarding process can be overwhelming. What we do clarify is that the onboarding process is as simple as they're willing to participate. So it can be done in as little as 48 hours. It can take a couple weeks, just depending on the back and forth to get them built into the system. Um, so that typically is the resistance. Some other you know roadblocks I guess we've run into is that getting to the decision maker, um, the collaboration between other participating programs in their state so that we understand that the platform is only as effective as the organizations that participate. So it's why we're asking for introductions to state coalitions, funding entities, government, anyone who supports shelter programs in your state, because once we're able to get introductions broadly to states and all the programs that participate there, they understand the benefit. It's a group effort. So we see some resistance there. But what we have heard is that the ones who are using it, and there, certainly are a number of programs participating, that it creates just an incredible ease of use. Did I answer those two pieces or those pieces?
I think so.
And I'll
Okay.
say with the third portion of it, in regards to the uptick in usage, there are rural facilities who are now getting seen by other facilities that they wouldn't have been able to get that placement before. So if they didn't have a lot of traffic in and out, by them being rural, them being part of DP beds gives them higher visibility. So they can keep those beds fuller than they would if they were not participating.
Well, and on the flip side of that coin, what we have heard from some programs is we're always full, or we only serve a specific jurisdiction. So I'm sure that question is maybe floating around some of your minds, and that's okay. Like, it's free. Once you're in this, it's free to join. And so what this platform helps eliminate is the influx of calls and emails and inquiries coming into your shelter about who you do and don't serve. So that cuts your advocate's work time dramatically, just from eliminating the need to respond to those questions.
Thank you so, so much. There are a ton of other questions. I think I've already started trying to save them so that we can be sure to either answer the question, hopefully answer the question for folks, or either connect them to you directly, because some of these I think are pretty specific to folks' local jurisdictions because they're really interested in this tool. Um, I've
Absolutely. So we'll again drop our contact information into the chat. Please don't hesitate to reach out. Jennifer, thank you. I am responding to you right now. Um, I'm going to drop our email address here. Folks can also fill out a form if they want more information via our webpage. And I've just dropped that into the chat. But like we said, thank you for this. We are more than happy to have individual conversations or schedule time with bigger groups who are interested in learning more about DV beds.
Thank you so, so much for your time. This was really fantastic. We had a really awesome turnout. Please feel free to stay in touch with us. We'd love to stay connected. You can reach us at safehousingpartnerships.org. We're available for technical assistance. Next slide, please. These are some of the things that you can find on safehousingpartnerships.org. We aim to be a one-stop shop for all of your DVSA housing needs. Next slide, please. Other ways to get in touch with us. So in addition to safehousingpartnerships.org, you can email us directly at housing@nrcdv.org or look us up at the National Resource Center on Domestic Violence. And then if we could skip ahead to our survey. So we have an evaluation. I'll drop that link into the chat. If you could please complete that, we'd love to know what other sorts of things you want trainings and webinars on, and would love to know what you thought about today's presentation, any suggestions you have for improvement. If you've been here since the technical glitch at the beginning, shout out to you. Thank you so much. And a big, big thank you to our co-presenters, our partners at the National DV Hotline, as well as our ASL interpreters and our Spanish language interpreters. Thank you all so, so much. Take good care of yourselves. Look forward to being in this fight with you all for a long time.
Likewise. Thank you, Brittany.
Thank
Thank
you.
you, everyone.
Thank you so much.
Bye-bye.
Thank you all.